Hello and welcome to Where Health Happens. I'm Mike Morland. When you think about pharmacy school, you probably picture classrooms, laboratories, and clinical rotations. You might imagine students learning about medications, working with patients, or preparing for life behind the pharmacy counter. Today's guest is Gretchen Eikelberg, a fourth-year Doctor of Pharmacy student at Wayne State University who recently traveled to Washington, D.C. for RxIMPACT Day, an annual advocacy event sponsored by the National Association of Chain Drugstores. There, she joined pharmacists and student pharmacists from across the country to learn how healthcare policy is shaped and to meet directly with lawmakers about issues affecting the pharmacy profession and the patients they serve. So what happens when a student discovers that important patient care isn't just about medications, but also about the policies behind them? That's what we're going to explore today. And with that, Gretchen, I'd like to welcome you to the show. Thank you so much for joining me today.
Thank you so much for having me.
So before we dive into your experience in Washington, tell us a little bit about yourself and what drew you to the field of pharmacy.
Well, from a young age, I always had a really good memory, and my mom kind of just saw me in the pharmacy field, working in your more traditional pharmacy roles. As a child, I kind of ignored that. But when I got to the end of my high school career and at the beginning of undergrad, I graduated high school in 2020, and I saw how pharmacists can really impact the healthcare field and how they were stepping up in the front lines, and I felt very
Right.
inspired. So in undergrad, I kind of started on this pre-pharmacy track and I started working as a pharmacy technician at Rite Aid and I fell in love with the profession and I knew it was the right thing for me. So I applied to pharmacy school and from then on it's just been perfect, really. I love it.
Yeah, and here you are. So,
Yes.
so let's start with how you heard about RX Impact Day and what made you want to get involved.
So our Associate Dean of Pharmacy, Dr. Susan Davis, invited me to be our college's representative at this conference and the congressional visits and everything. She sent me the link and I looked into it. It was specifically sponsored by the National Association of Chain Drugstores and it was advocating for community pharmacy changes on a legislative level. And that's something I've always been very passionate about as someone who's worked in community pharmacy from the beginning
Mhm.
of my pharmacy career and has seen pharmacy closures and was part of one myself. So I saw the impact that pharmacy benefit managers and all of these legislative things are really how they really impact what's going on at the
Mhm.
level that I'm working at, whether it's as a student, as a technician, and even the patients. I had plenty of patients at Rite Aid
Mhm.
that had to transfer to places they didn't want to go. They had to step away from their known caregivers, their pharmacists,
Mhm.
technicians, everyone at the regular store, and they had to uproot a lot of things in their lives. And so I saw the impact from the beginning of my pharmacy career and throughout now as I work
Mhm.
at CBS and am in practice on my clinical rotations. I see that it's important. And so when I was given the opportunity to go to Capitol Hill and talk about it and advocate for the changes that are absolutely necessary to keep these pharmacies open and
Mhm.
functioning to their full potential, I knew it was the right thing to do and a great opportunity for me.
So before you started pharmacy school, did you ever imagine that politics in your future career would intersect in this way?
Strangely enough, this was not my first experience with doing any advocacy on the pharmacy, stage.
Mhm.
I had done some at the state level with our Michigan Pharmacists Association and a little bit at the national level with the American Pharmacists Association the summer prior. But before pharmacy school and before any of that, I had no idea any of these things were happening. It was completely foreign to me. They don't really talk about it a lot on a very public stage. So even a lot of
Okay.
our patients don't know that these things are going on. So
Right.
going into pharmacy school, I really thought I was going to go to class,
Mhm.
study a lot, and probably not sleep very much, and then graduate with my degree. But it's been so much more than that, clearly.
Yeah, and I think it's important to even call out the fact that especially people working in this industry, you're the ones working directly with the patients, having a voice, especially directly with our representatives, I think is so important, being the ones who know the field the best and being able to
Mhm.
advocate for it to our elected representatives, I think is just
Absolutely.
so critically important to the work that we do now. And then the future students that are coming in to, be aware that this is something that, you know, uh, others aren't going to advocate for it if you don't advocate for it yourself.
Absolutely. And they always say, like, if you're not at the table, you're part of the menu or something like
Yeah.
that. But that's something I've heard a lot in this context, and I think it's
Mhm.
very true. And even as students, like we might not feel like we have the expertise to do it yet, but
Yeah.
we're out there, we're working,
Yeah.
we're learning, we're in the field. So
Right.
getting involved is so valuable.
Right. And you got to start somewhere.
Yes.
Yeah. So, what were your expectations in going to Washington versus the experience you actually had?
I expected some congressional visits and a little bit of training beforehand because they did mention that all of the students participating would be going to the RxIMPACT-U,
Mhm.
which was a training session before the actual
Okay.
visits. So I expected that. I didn't know how in depth they would go.
Hmm.
So when I did actually get to the fly-in and do the RxIMPACT-U day and
Hmm.
actually go to the congressional visits, I didn't realize one how many we would do. The team that I was with did 5,
Oh,
which
wow.
was more than most.
Yeah.
But we also visited all Michigan Congress people, which was really
Okay.
great because I'm from Michigan. And in the RxIMPACT-U the day before was a lot of really in-depth training, not just about
Hmm.
like the issues at hand, because that was obviously the most important thing to cover, but
Right.
also like how to effectively advocate.
Hmm.
So really tailoring that message. And previously in other experiences with the Michigan Pharmacists Association, with other national Congress visits, we didn't have a lot of that training. And I feel
Hmm.
like it was really important to get that, to know how to tailor that message to our
Right.
Congress people. And I felt like it was more impactful because we kind of knew what we were doing a little better.
Yeah, and I feel like you make a really important point. It's always so good to be able to get some type of training and feel prepared for going into something new like this, especially meeting members of Congress. The last thing you want to do is walk in and feel unprepared and uneasy. You want to be confident. It's much better than trial by fire and just hoping for the best. So,
Exactly. And having just an idea of what those conversations look like was
mhm,
really helpful and also kind of took the anxiety out of it.
right. So, what would you say were the biggest things you learned about healthcare policy during this process?
Well, so the biggest thing I learned about healthcare policy in general is that it moves very slowly, which I think a lot of things in healthcare do. So that wasn't a
Hmm.
surprise to me. But one of the biggest things we advocated for was pharmacy benefit manager reform, which has been passed. Like
Hmm.
the bill has been passed in Congress, which is huge and historic, but it's not the end. So in my
Right.
head, I was like, oh, we've done it, the bill is passed, things are gonna fix themselves. It'll be great, but that's not the case, and that was a big thing that I learned.
Hmm.
And that's just anything political, like
Right.
passing the bill is only the first step and not
Right.
the last. But it was something that like we really had to hammer in because when we were going around talking to our legislators, we were still bringing up that issue, and that was still our number one thing that we were talking about because the momentum has to continue after signing the bill. It has to
Hmm.
keep going. We have to start implementing these changes on a national level and start working on getting those at the state level as well. So it moves very slowly. We have
Hmm.
to be patient, but we also have to like push for continued
Right.
support of these things so that they don't just end up being filtered away and
Right.
ignored with the rest of a lot of things.
So, was there anything that surprised you in how pharmacists can influence policy?
I think before pharmacy school and before these experiences, I
Hmm.
didn't know that pharmacists got involved politically at all. We
Hmm.
actually have, I think, 2 or 3 pharmacists in our national Congress right now. I don't remember their exact names, but it's two
Hmm.
or three. And I didn't know that that was a path for pharmacists. I thought it was really cool to learn that, you get your PharmD, and you can go into politics. That was really
Yeah.
interesting. But also that pharmacists have any interest in things politically anyway.
Hmm.
Healthcare, unfortunately, has become a political topic and something
Right.
that we need to advocate for. So I didn't really see that pharmacists were as involved in it
Hmm.
as they are. And now
Yeah.
I see that. And I see that a lot of people take it into their career and make it a big
Right.
part of their career as a whole. And I think that's really inspiring. And it also gives a whole other opportunity for students in pharmacy school that maybe don't like the clinical aspects of what we
Hmm.
do and maybe like the more leadership focused or the
Hmm.
advocacy or the overall like system changes that they can make in with a
Yeah.
PharmD. And with that knowledge, students and pharmacists can get involved in that on that
Hmm.
level as well, whether it's with associations, whether it's working in political offices and helping
Hmm.
out politicians. We had one of the legislative aides that we met with was actually an MD, so a medical
Hmm.
doctor, but similar concept. Pharmacists can get involved in those positions
Right.
as well. And it was really cool to see exactly the versatility of this degree and this profession.
Yeah, and I think it's important to note when we think of our elected officials, they are representing all of us. But the reality is, like all of us as well, they only have very narrow areas of expertise. They may have a large body of knowledge, but the reality is they are relying on us as the experts in our individual fields to really help guide them. So it's important to speak up, whether you're a doctor, a lawyer, in this case, a pharmacist. And I think it's equally as important that as a student, you're starting this work now and it's really leading you into a career of advocating for the field and for public health.
Absolutely. And I see a lot of my classmates getting into similar
Yeah.
sort of roles, and it's really great.
So, walk me through a little bit your first meeting with the legislative staff and any memorable conversations or moments from that experience.
Our first meeting, the students in our group, which was me and another student from Ferris State University, we kind of took a back seat and watched,
Hmm.
the pharmacists and some of the lawyers that were with our group of pharmacists
Hmm.
do most of the talking,
Hmm.
just to kind of give us an idea of what was going on and
Hmm.
how to approach these conversations. We actually met with Representative Rashida Tlaib from, I
Okay.
think, the Dearborn area.
Right.
But she was a lovely person, very energetic, and she's a huge supporter of all of the bills that we were
Hmm.
trying to like get support for, the PBM reform, the ECAPS bill, and then we also talked about Trump RX. So we went through each of those kind of in a systematic
Hmm.
way, discussing each what the impact of each was, why we need the
Hmm.
support, and why pharmacists are in a good position to
Hmm.
be those sorts of providers.
Right.
So a lot of that was conversations focused around those. Any questions that the legislator had about, pharmacy education, about the pharmacist's role, what we see on a day-to-day basis. Of course,
Right.
we were there to answer as a student. I did talk a little bit about what we're learning in school because one of the
Hmm.
bills was ECAPS, which is about test to treat um, billing in the
Hmm.
community pharmacy setting, but also in other pharmacy settings. So
Hmm.
allowing pharmacists to bill Medicare for testing for
Right.
things like strep throat, COVID, flu, a lot of
Hmm.
those, kind of short-term illnesses that are
Yeah.
easily treatable.
Hmm.
Um, And we talked about like, hey, like in school, we are trained to test for these things and
Hmm.
also prescribe therapies for this. But right now, we're not able to bill for it. So here's my experience in the classroom and in
Hmm.
our experiential education. And this is why this bill is not
Hmm.
just important for for your constituents to
Right.
stay healthy, but also feasible. Like this is something pharmacists are completely capable of doing.
Hmm. So now that you've had this experience, what would you say are the most important aspects of this profession in the state of Michigan moving forward?
I think the next step on a whole like statewide
Yeah.
stage as well as personally is that grassroots advocacy. So
Hmm.
really pushing for teaching the public about what pharmacists do, what we're capable
Hmm.
of doing, because at the end of the day, we can get people to pass bills in the
Hmm.
legislation, but we need to keep those people in office. And we
Right.
need to tell our legislators, tell people running for office that this is an issue that matters not just to pharmacists, but to
Hmm.
patients as a whole and to everyone, really,
Right.
because it keeps people healthy if we have providers and people that can
Hmm.
do more things in an accessible location like a
Hmm.
pharmacy. So, teaching the voters what
Hmm.
really happens behind the pharmacy counter, what happens
Hmm.
in pharmacy schools, that we're not just counting pills all day
Right.
and selling drugs, like teaching them the clinical, like what goes on, like in our minds and all of the
Hmm.
clinical expertise that goes into pharmacy and
Hmm.
what we are capable of doing, that we do not just know what the drugs do, but which ones are the best for which conditions and that sort of thing. And so teaching the public about that, I think, is a long journey. It will be,
Hmm.
but
Right.
really implementing those things, putting out flyers and educational materials and
Hmm.
things like that to really get the public on board with supporting these issues so that pharmacy as a whole can advance and
Mhm.
provide more for the community.
So, as you were having these conversations, whether you were active or passive in them, was there anything being discussed that jumped out at you that may have been misconceptions about the profession?
Not directly,
Okay.
but sometimes it's always like they're surprised how much we do in school. That was
Okay.
one thing.
That was gonna be my next
Yeah, I'm
question.
like we were telling one of the legislators about what our school looks like and once again why this is
Mhm.
feasible and also what our experience, both me and the other student, work at CVS. So
Right.
we're in these settings, we're actively working, and so we were telling stories about how all of the PBM reform, all of the
Mhm.
limits on treatment and everything are
Mhm.
impacting the people that we know. And they're like, wow, we're surprised to see how students do get involved at this stage. And we're surprised to see that this is actually part of the pharmacy education. And some people, even in my personal life, have been surprised that a pharmacy degree is a doctorate to begin with. So,
Yeah.
like, kind of getting that information out there, I think is really important. But those
Yeah.
misconceptions are definitely there. And there's a lot of efforts to address it
Mhm.
with pharmacy influencers online and
Mhm.
the whole profession's push to get more people into pharmacy.
Mhm.
Um, but it's a slow moving thing.
Right. Unfortunately, some of the most important work done often moves the slowest, and sometimes we just wonder, why can't we usher this along?
Yeah.
So I think
Why
that's a
don't people
challenge.
get it yet? But
Yeah.
it'll just take time.
Yeah. So what would you say to another pharmacy student who may be considering an opportunity like this in the future? What would you tell them? Maybe something from your experience, but also something you wish you would have known going into it.
I'd say do it. Even if you're a little scared, it can be
Mhm.
a little intimidating to go and talk to anyone that isn't a pharmacist, you know, whether it's a legislator or talking to the public
Mhm.
about pharmacy issues, but you know more than you think you do, and
Mhm.
you can really have an impact there. My I think from the beginning of my like journey with, you know, getting
Mhm.
involved in advocacy, I was a little
Right.
afraid of like speaking up and saying anything.
Yeah.
And then while I was in these meetings, I realized these legislators haven't worked in a pharmacy for the most part.
Mhm.
The ones that we
Right.
talked to, they hadn't worked in a pharmacy. I do know more about this than
Yeah.
they do, and they want to learn from me.
Mhm.
So as a student, even talk in these meetings if you can, even if you just say, yeah, I've worked in a pharmacy for a while and this has impacted my
Mhm.
patients. Just telling those stories, even just the little ones. At another legislative day that I did with the Michigan Pharmacists
Mhm.
Association, I spoke about how a pharmacy benefit manager forced one of my patients to
Mhm.
move to a different chain pharmacy and had to fill in a different place, even though we were still open, still completely capable of filling her medications. And that was a big
Mhm.
frustration for her because
Yeah.
she's an older patient who had gotten used to our care and our
Yeah.
processes and everything. And like just telling those stories has so much value because that's something
Mhm.
that those legislators they unfortunately don't see. And they can't
Mhm.
come and just work in a
Right.
pharmacy for a day and see all the problems. So
Right.
to students, like you know more than you think you do,
Yeah.
you are an expert in this field.
Yeah.
Like as much as you might not feel it yet. And yeah,
Mhm.
if you're surrounded by a bunch of pharmacists, you're definitely not going to feel it as much, but you do know more than the people you're advocating to. So trust yourself and speak up. Just say anything. Literally, those little stories, that's
Mhm.
what really sticks with people because that shows that this is real and impacting real people that are struggling
Right.
with all sorts of things, whether it's medical conditions on top of now insurance issues. Like,
Right.
really talk about it.
Yeah, I think that's really great advice. And we're actually getting close to the end of our time together here, but if you could walk away from today sharing one piece of advice or one thing you'd want people to remember from our conversation, what would that be?
That there's a lot of changes coming in pharmacy, hopefully sooner rather than later, but continue pushing for it, continue advocating for change to all of the students out there. Get involved. And whether you're in pharmacy or not, get involved in advocacy for your profession because that's what keeps you afloat and that's what will make the changes that you need in order to have a better career possible.
Mhm.
So stay with it, keep pushing.
All right, I think that's a great place to leave this episode. Gretchen, thank you so much again for joining me, and thank you to everybody who tuned in. If this was your first time listening or you've missed a few episodes, go back and check them out. We had a great conversation with Susan Davis and Lynette Moser about the history of pharmacy and supplements and how that impacts you and your health and the things you need to know to be an advocate for yourself. So until next time, I'm Mike Morland, and this is Where Health Happens.